Maayong adlaw kaniyong tanan. First of all, thank you for inviting me today to share my thoughts on the 2019 Expanded National Nutrition Survey. Given our present reality with the COVID-19 pandemic, facts and numbers have become even more relevant. Information is power, and surveys, like all forms of data, assist all of us in government or in the private sector to make informed decisions on issues that matter. Simply put, the more information and data we have, the more likely we will be able to come up with policies and programs that are truly responsive to the needs of people. Surveys provide a part of the decision-making architecture in government and other organizations as well. The 2019 Expanded National Nutrition Survey, or ENNS, conducted by the Food and Nutrition Research Institute of the Department of Science and Technology, aids us in the issues on household food security and nutrition in all sectors and at different life stages. It is also notable to stress that the numbers and data particularly provided by the 2019 ENNS do not exist in a vacuum. It is a correlation of different conditions and factors that are validated by their numerical equivalents in the survey. It is also important to remember that these numbers are not simply statistics. They relay the country's condition in terms of household food security and nutrition, two important conditions for a nation. As Winston Churchill once said, healthy citizens are the greatest asset any country can have. These being said, allow me to provide my take on the 2019 ENNS. For household food security, it is heartbreaking to know that there is a significant increase in the proportion of food insecure households. We are now at 64.1%. It is clear that more efforts should be done to achieve household food security, especially in the identified areas of the 2019 ENNS, which pointed out where food insecurity were highest among households in rural areas, with heads with lower educational attainment, and engaged in agriculture, to name a few. Clearly, in this aspect, there is a need to assess further factors or stressors that are contributory to the results. Perhaps in this time of crisis, it is even more important to build on the equity of the households more prone to food insecurity. Building on their capabilities on education, access to food, and access to economic opportunities will enable them to maximize opportunities on food access. In enhancing their capabilities, they will be enabled to provide the food necessary for their household. This shows that food security and human development go hand in hand. Now, regarding the results on nutrition in different life stages, we see that nutrition is multi-sectoral. It has interconnected dimensions on health, economics, social cohesion, and community development. Stunting in at least 1 in every 5 children under 2. 19% underweight among preschool age children group. 42.2% and 31.4% stunting among poor and poorest adolescent 10 to 19 years old, respectively. 11.7% prevalence on wasting on the same group. 22.9% prevalence of nutritionally at-risk pregnant women who will deliver low birth weight babies, and increased chronic energy deficiency among the elderly and others are indications that health and nutrition involves proper allocation of resources to aid primary health responders in communities, like barangay health stations and rural health units. So in doing so, we are able to make available essential health services, human resource and dietary supplements, and other essential medicines, even at the grassroots levels. Communities play a crucial role in safeguarding the nutrition condition of every individual. Thus, the systematic allocation of resources, fiscal or otherwise, should be the norm for us to provide a coherent, multidimensional approach in addressing the numbers espoused by the 2019 ENNS. In doing so, we will be able to properly address the nutrition supply and demand spectrum of different sectors in different life stages. Particularly in this pandemic, we are now beginning to see certain gaps in some policies, programs, and interventions on households' access to food and nutrition. COVID-19 has actually exposed tensions on policies and resources which have great effects on achieving enhanced capabilities to eradicate hunger and malnutrition. Thus, I invite all stakeholders to become active partners in increasing human development by creating an environment of assessing policy and program response and provide premium to increasing the potential of people to access food sources so as to enhance their nutritional state. It is important to emphasize that government unceasingly works to enhance the nutrition condition of the country and allow households to properly secure food. As such, during the start of this administration, the government made the Philippine Development Plan, or PDP, 2017 to 2022, to lay down the blueprint of its development agenda. In Chapter 8, in fact, of the PDP, expanding economic opportunities in agriculture, forestry, and fisheries, it outlines the strategic framework, targets, strategies, programs, and projects on how to address the issues on food security, and also outlines the multi-sectoral and multi-level approach to address malnutrition. It is important to note that PDP is actually undergoing a process of updating or enhancement in order to account for the new normal brought about by this COVID-19 pandemic. Also, a sectoral plan was also instituted to complement the PDP, specifically the Philippine Plan of Action for Nutrition, or the PPAN 2017 to 2022. As you all know, the PPAN consists of 8 nutrition-specific programs, including those of the Department of Health, and an initial list of 11 nutrition-sensitive programs and 3 enabling programs, which ultimately has the goal of improving the nutrition situation of the country. In addition, Executive Order Number 101, entitled Creating an Interagency Task Force on Zero Hunger, was signed by the President on January 10, 2020. The composition of the Zero Hunger Task Force, of which I am chair, and the Secretaries of Agriculture and Social Welfare and Development as vice chairs, while the members are the Secretaries of Agrarian Reform, Budget and Management, Education, Environment and Natural Resources, Health, Labor and Employment, Interior and Local Government, Trade and Industry, Science and Technology, the Presidential Communications and Operations Office, the Director General of the NEDA, and the Chair of the Commission on Higher Education. The issuance of the executive order underscores the need to carefully coordinate, rationalize, monitor, and assess the efforts of all government agencies to ensure a whole-of-government approach in eradicating hunger, enhancing nutrition, and achieving food security. On the fiscal aspect, President Rodrigo Duterte approved the proposed 4.5 trillion peso national budget for 2021. The proposed fiscal year 2021 budget aims to sustain government efforts towards effectively responding to the COVID-19 pandemic by focusing government spending on improving our healthcare systems, ensuring food security, increasing investments in public and digital infrastructure, and helping communities cope and prevail in these trying times. The budget's Reset, Rebound, and Recover, Investing for Resiliency and Sustainability theme is consistent with the government's goal of saving lives and protecting communities while making different sectors of the economy stronger and more agile. Amidst political polarization, concern for our individual circumstances, we need to ground ourselves with our Filipino spirit of pagkakaisa and be reminded of our country's kapit-bisig experience in providing solutions, whether we are faced with a pandemic or without a pandemic. Ladies and gentlemen, we have proven so many times that our shared sense of responsibility or bayanihan is the core of our people. Together, we can achieve many great things. Our collective action in these times show how we regard that together we can overcome and all heal as one. Daghang salamat sa inyong tanan.